Hello everybody, I am Ushma Goradia and I'm going to talk about screen time and its effect on kids' behavior. So, screen is an indispensable part of our world today. It has become an unavoidable part of our lives. Screen and digital technology itself are the very reasons that you and I are connected across hundreds and thousands of miles. This very screen has been very helpful in staying connected with our loved ones during the recent COVID times, and it has helped our kids attend online school, made life easier for us, and much more. The screen definitely makes our life much easier, convenient, and we get things done right from the walls within our home, staying within our home. We see the screen being used by so many people, almost each one, across ages, across socio-economic classes. However, as a clinician, as a pediatric physiotherapist, I often think that as much as we need the screen, what are the consequences of using the screen? So the positive consequences, we already know that we stay connected and we can talk to each other and we can conduct online events such as this. But then what are the other consequences, the negative consequences in our lives and particularly in our children's lives? So today's topic, the kids' screen time and how it affects their behavior. I'm going to talk more about, emphasize only on children. What does the screen do to children? And this information is for all children. It is not only for children with special needs or autism or developmental disorders. This information that I'm going to share here today applies to all children, particularly younger children. And when I say younger children, ages from birth to about 5 years. Now, so what does prolonged screen usage lead to in a child's life? And when we say prolonged means almost 4 to 5 hours per day, day in and day out, when a child is using a screen. And this screen can be in any form. It can be television, it can be a laptop screen, it can be a computer screen, and more often we see cell phones, mobiles, or tab being used by young children. So screen time is associated with behaviors of decreased eye contact, delayed speech, communication and language, frustration and aggression, sleep issues. It can also interfere with development of cognition, social skills, and can create anxiety very easily among young children. Now, all of this, what I spoke, all of these behaviors have also been validated in the last few years by research studies published in the fields of psychology, child development, parenting, and brain science. The UNICEF also now says that babies and toddlers need face-to-face interaction from their parents and caregivers, because if they miss out on this face-to-face interactions and if they are replaced by screens, then babies and toddlers have difficulty in understanding the non-verbal cues. They have difficulties in interpreting the non-verbal cues, which later leads to difficulty in language. As a pediatric physiotherapist and a sensory integration therapist, for me, the number one reason for screen time, my number one concern is that it prevents physical activity. It takes time away of a child's physical activity. So, when physical activity is lacking or it is not enough, we know that there are risks of overweight, obesity, and perhaps diabetes. We have a huge increase in numbers of children recently diagnosed with diabetes during the COVID times. And yes, the diet and the food also contributes to the diabetes, but then there is also lack of physical activity and spending too many hours online. A movement deprived child, when the child does not engage in physical activity, does not engage in meaningful movement frequently, a child starts demonstrating sensory issues. That is a great concern for parents nowadays. So as a therapist, I would like to bring your attention to something called the body-brain connection. The body-brain connection means that the brain develops through moving in space, moving against gravity, and interacting with the real world situations, having real life experiences. Brain also develops in response to problem solving. So for a young baby, within a few weeks of life, when you show them a toy, they engage in visually tracking the toy. In later sometime, a young baby follows their mother across the room just using their eyes. That means the head turns and the eyes also turn. If you show them a toy, they may try to reach and bat for the toy, reach for the toy, grab a toy. As soon as they learn to roll and crawl over and walk, they move across the other end of the room and try to explore toys and objects in their environment. Now, when they manipulate objects, they turn the object, they shake the object, they bang the object, they throw the object. All these are experiences necessary for brain development. They are interacting with a real world object versus a screen. Remember, screen is 2D and it's a virtual world, whereas the brain develops in response to interacting with 3D world, that is our real world. So, all of these experiences start very early in life, right from, a newborn within the first few weeks of life. And all of these real experiences help us to learn through exploration, through trial and error, which a screen does not. Now, it is important to remember that 80% of adult brain size is reached by age 3 years. 80% of adult brain size is reached by 3 years of age. That is, they say, the first 1,000 days of life. 90% of adult brain size is reached by 5 years of age. And by 6 to 7 years of age, the child's brain looks like an adult brain. Not to say that the brain stops developing after that. The brain continues to develop throughout life. However, the first 3 to 5 years, particularly the first 3 years, are very critical in developing the brain architecture. The brain architecture develops exponentially during the first 3 years and then in another 2 years. Now, brain architecture is again influenced by genetics, influenced by experience, and influenced by the environment. So, genetics we don't have too much control on. However, as humans, as parents, as adults, we do have a lot of control on the experiences and the environment that we provide to our children. And that is the experience that I just spoke about a minute ago, that when the child moves across the room, a child shakes and bangs objects, throws objects, manipulates objects, opens them. They try to reach overhead and try to pull an object from the table. They try to, by 2 years of age, they try to lift an object and walk across the room. So all of these experiences are providing sensory feedback to the brain as to what color is the object, what size is the object, can I lift it? If I lift it, how much effort do I have to make? Does the object produce noises? That's why I'm shaking it, to listen to the auditory input that my brain likes. When I throw the object, I get proprioceptive input, in terms of how heavy the object is. Problem solving, how do I get the toy that is under the table? Do I crawl underneath? Do I bend? Or how do I get something that has fallen under the bed? Do I get a stick? Do I get a broom and push the object out? This is called problem solving in the real world, through real life experiences. Through all of these experiences, there's a lot of sensory motor foundations are being laid during the first 3 to 5 years of life that are crucial for all later learning in life. So if these foundations are strong, the sensory motor experiences in the first 3 to 5 years of life, if these are strong, then you will, as an adult, that child, when they grow up into an adult, will learn how to learn and can learn anything. So what else does screen time, that's prolonged screen time, do to children? Screen time, besides the lack of physical activity and the sensory motor experiences associated with it, prolonged screen time isolates the child from human interactions. Human interactions right from the baby stage are very necessary for development of communication, speech and language. All that a young baby wants, all that a small baby wants is a mother's face, a parent's face, or the caregiver's face. Young babies intensely or keenly watch the movements of the lips, the jaw, the tongue when the mother or the parent talks to them. That's when they start imitating the mouth movements that are necessary for later speech. Young babies also listen to the mother's and the parents' voice, the tone and the pitch of the voice, the loving voice, the calm voice that tells them that everything is fine in the world. And this is and the baby responds to it, by kicking their arms and legs, or maybe rolling over, or coming to sit and climbing into the mother's lap. Now this is called two-way interaction. So communication is two-way interaction, and that's where speech and language development form. Now, and then further they lead to emotions, bonding, and language. So if the baby is just seeing, the mother's face holding a screen all the time like this, they are missing out the important opportunity of looking at the movement of the mother's mouth, the lips, the tongue. They are missing out an important opportunity of imitating mouth movements that are necessary for speech and feeding. So recent research also says that too much of screen time, prolonged screen time, even to babies, or any screen time to babies, inhibits the baby and the toddler from learning to read faces, from learning social skills. And reading faces and learning social skills are the key factors that lead to development of empathy in later life. So a prolonged screen time in very young children, that is to babies and toddlers, are also at risk of not developing that empathy, the component of empathy. Okay, now, so there is something called as virtual autism, and this virtual autism, the term has been coined by a Romanian clinical psychologist, Dr. Zamfir. You can Google and find out information about him. He has coined this term virtual autism, and he says that virtual autism occurs when children under age 3 to 4 years are exposed to excessive screen time, and that these children demonstrate autistic-like symptoms. Dr. Zamfir and his team found that when they removed electronic devices totally from a young child's life, they saw changes. And what were those changes? Reduction in autistic symptoms, increase in IQ, and improvement in overall performance. And these changes occurred positively at least up to the rate of 37 to 38% in a child's life. And in some children, the autistic symptoms are totally reversed because the child did not have a classical autism. The child had autistic-like symptoms related to screen usage. So what Dr. Zamfir tries to make a point is that the screen time can also cause autistic-like symptoms in your child, excessive screen time. And he says excessive screen time is 4 to 5 hours per day. Now, so there are some other issues I will cover very quickly. Sleep, frustration, and anger that are the result of excessive screen time. Sleep, when a child uses excessive screen time, sleep is affected in many ways. Sleep is affected in terms of quality of sleep, that is how well do they sleep. Sleep is affected in terms of duration of sleep, that is a child does not go through a long sleep that is very much needed for tissue rejuvenation. And then children with excessive screen time also take a longer time to fall asleep, that is called sleep latency. So why does this happen? It happens because screen time takes away opportunities of being in natural light, which again is associated with low levels of melatonin. Now, melatonin is a natural hormone that our body produces that helps us sleep. Also, the blue light that emanates from backlit devices like the cell phone, the tab, this blue light suppresses the function of melatonin and leads to sleep issues. So it is recommended now that screen needs to be avoided at least 1 to 2 hours before bedtime. This recommendation is for adults and more so for children. Excessive screen time leads to frustration and anger. Now, the noise and the light coming from screens, even be it television, when a child is watching cartoons, the noise and the light, even from cartoons, can generate emotions that the child has difficulty coping with. To me, as a clinician, instant gratification is a serious concern. So what is instant gratification? Instant gratification is getting what you want right now without waiting, without problem solving, and without making effort. That is what I understand instant gratification, and prolonged screen time is one factor that leads to instant gratification among children. So I'll give you an example. When you are doing a puzzle on the screen versus a puzzle in the real world. On the screen, when a child tries to choose a puzzle piece and fix it, if it is wrong, the screen pings, trying to tell the child this is a wrong piece, and the child goes and takes another piece. But in the real world, when the child is fixing a puzzle, the child is actually feeling whether it is cardboard, whether it is wood, whether it is soft, whether it is hard. The child is actually paying attention to whether the puzzle piece has a matching color, whether is it a border piece, is it a corner piece, will it fit appropriately. So there is this development of attention, patience, waiting. And that's the difference between doing a puzzle on a screen and doing a puzzle in the real world. So I come back to the instant gratification, that the screen provides instant gratification. If you are right fixing the piece, it fits. But if you're wrong, it pings that no, this is a wrong piece and you need to search for another one. But in a real world, fixing a puzzle takes time, effort, and problem solving, attention, visual processing. All of these lead to brain development. Now, too much instant gratification over time can lead to impulsiveness and prevent a child from engaging in meaningful behaviors. So, the consequences very likely are frustration and aggression. Now, addiction is another likely addiction. Addiction is basically, they found through research that when teenagers watched a lot of TikTok videos, the areas of the brain that lighted up are associated with addiction. So the same areas of the brain that are associated with addiction lighted up while watching TikTok videos. So there we have a connection. And the instant gratification, the addiction is basically the child will do anything, will go through many screens, will swipe the finger, will just tap on a button, and there the music changes, the screen changes, the information changes. Basically the information that they are getting is too quickly but is not absorbed very well. And when it doesn't happen, if the cell phone is taken away, then the child gets frustrated, the child gets angry, and gets mad at parents or the adults who take away the screen. Very recently, a high school in Sydney, Australia banned mobile phones in school, and they witnessed a positive change. They witnessed dramatic changes in behavioral issues. That is, they saw a significant reduction in behavioral issues among high school students. They saw increase in physical activity, and more importantly, they found that students started talking to each other, which is what? Social skills that we all want our children to engage in. So here is the connection. Now, research is coming out in the last few years, 4 or 5 years. There's been a lot of research, as I said earlier, in the fields of brain development, parenting, brain science, associating screen time with negative consequences. So we have enough, information to understand how harmful screens can be. Now, in my clinic, in my practice, many parents tell me that they use a screen for educational purposes only. So I ask them, what do you mean by educational purposes and what age is the child? So they are using the screen. They are using the screen for teaching educational components like letters, numbers, alphabets, etc., etc., which is fine. However, think about it. The smartphones and the screens are in our lives very commonly only today, since the last 15 years or maybe 17 years. How did children learn before that? Children learned from the real world. When a child learns from the real world, they learn the meaning of words through social interaction. When a mother says, let's put on shoes and go out, the child starts associating the action of putting on shoes and going out the door. So the child learns some meaning and context in this situation. Whereas I myself have witnessed in my practice that children who know their numbers, they can say 1 to 10, 1 to 20, but have no idea how to count 10 objects, one, putting it from one basket to another. They have no idea. Or they may know their colors, red, blue, green, but they are unable to match to the correct, puzzle board or whatever I want them to do. That is application. When children learn language from cartoons, they learn the words, but are they learning the meaning of those words? Are they learning the two-way interaction? So children who have learned language from TV cartoons generally speak in that same tone and pitch of the voice of the cartoon character. But when you ask them simple questions like, what are you doing? Or what is this girl doing? They cannot answer. They answer with an echolalia. What is this girl doing? What are you doing? And therefore, educational purposes, when we talk about educational purposes, I think we have to think about mindful usage of the screen. That is, if you are using the screen in a young child, think about why are you using it? Can you do the same thing in the real world? Because the real world is much more enriching to the brain. So what are the recommendations? Generally, the worldwide recommendations from the medical fraternity are that no screen time till 2 years of age, and then 2 to 5 years is only 1 hour per day, and then I think 5 to 6 years and thereafter is 2 hours per day. These are the worldwide recommendations right now. So remember, no screen until 2 years of age. And, yes, learn from the real experience. Now, how to limit screen time? That is the biggest question. So how do you limit screen time? Parents are having a difficult time limiting screen times because the screen is seen everywhere, used by everybody. So how can you say no to your child? The important thing that you can do is be a role model to your child. Put away the screen for short periods of time in between. Stop checking your phone every 2 minutes or 5 minutes. Be a role model. Do things together as a family, that is, create media free times. Involve your children in meal preparations, in cooking. Go for a walk together, go cycling together, read a book together. All of this creates bonding with your child. You can clean up the room together with them. Engage in play. Play is a lost art. It is fast becoming a lost art. Making forts from chairs and tables and bed sheets, dressing up, playing with pots and pans. This is all becoming lost. And these play skills, they stimulate imagination, they stimulate creativity, they stimulate language. When you engage in play, remember, play, everything learned through play is another foundation for learning in life. Create media free times, create media free locations, such as no screen on the dining table, no screen during meal times. Rather you talk with family members. uh, no screen in the park, no screen in the car, and no screen during bedtime. So create screen-free locations, engage in outdoor play in natural light, arrange play dates with your children and their friends. And then screen also causes eye strain to children from a very young age. So how do you avoid this eye strain? Follow the 20-20 rule. This rule applies to adults more so for children. The 20-20 rule is go away from the screen every 20 minutes, walk around at least 20 feet, look, focus your eyes at a 20 feet distance for at least 20 seconds. Try to follow this 20-20 rule and see how it goes with you. Now, so yes, screen time, limiting screen time is difficult. It is daunting. However, it is not impossible. We can provide screen time in a limited way, in a disciplined manner, and use it mindfully. That is, why are you using it for a child? Ask the question yourself. Along with it, emphasize physical activities, promote real life experiences. All of this will lead to children who are going to become tomorrow's citizens. They will become robust physically, emotionally, and socially. Our children are worth the effort towards building a better world for tomorrow. Think about how did the world exist just 15 years ago, because many parents, it's very sad to hear parents comments, I didn't know what to do with my child, so we gave the child the screen. So then it definitely warrants that we look at the world just 15 to 20 years ago. It's very easy to shrug off, oh, that world doesn't exist anymore. It does exist. We need to borrow pieces and parts from there which enrich our children's life. Just like we do with food. We just cannot say, oh, everybody eats junk food. We do understand that junk food is not, right for your health, not right for your heart, not right for your gut. That's what we say nowadays. So we don't give the excuse that everybody is eating junk food, or we cannot cook like we did before. Well, there's always a way to work around situations. Where there is a will, there is a way. Thank you for listening to me. Thank you for all your patience. And if the audience has any questions for me, I would be happy to answer them right now. I see some comments there. How do you balance technology time with children who use technology AAC device for their method of communication? Now, this is a little different, because if your child is using an AAC device or a communication device, that means, yes, they have, they don't have much speech or not adequate speech. So this is a different question. You use the device only for communication, and the rest of the time you limit the time, you limit that time that they are watching videos or cartoons or engaging in video games. All those things, if they can be replaced or can be substituted by real play. So yes, you need to use a communication device when the child does not have adequate speech. I myself, advise parents for it. But then it's a different situation. It's a different situation. Today, what I spoke applies to all children, and when I say it applies to all children right from baby stages, right from baby stages. Autism, the diagnosis comes a little later, and then as a child with autism grows up, obviously we need to give them communication devices. Okay. Do you suggest having separate devices for communication and play? Maybe, why not? But then I would think how old your child is. If your child is, let's say, above 6 or 7 or 8 years old, then I would have these two separate devices. But even the play device, I would limit uh, to minimal. I would limit to minimal. As a therapist, I emphasize use of the body. I see so many children in my practice who are 3 years, 4 years, 5 years, even 6 years nowadays, now that we have come out, after 2 years of the COVID, now that children are starting to go to school, and, all the issues that we saw before, maybe they look more magnified to us. And when children come to me, I see them, they just don't want to use their body. Because all these years, the last 2 years, the last 3 and 4 years, they have not used their body. They have only engaged in learning academic information. As a sensory integration therapist, as a pediatric therapist, as a clinician who knows the connection between a body and the brain, and having worked for more than 30 years in this field, I understand how using the body is frequently in variegated ways is so important for brain development. So I hope I've answered that question. uh, Somebody says they can start with communication device as early as 2 or 3. Definitely yes, because technology has come a long way. Earlier they would use the sign language or the PECs, as a form of communication. But now the AAC technology, the digital technology has enabled, our children to communicate when they don't have adequate communication. Somebody has said exactly, parents need to bring their children outside more. So absolutely. So even children who are using the AAC or the devices for communication still need to come out outdoors, out of the house, into the park, on the grounds. Again, not malls though, that's my personal thing. But, walk in natural environments, move in natural environments. move their bodies in different ways, like bending, rotating, squatting, reaching, climbing, when you're in the house rolling, or when you are in a park maybe rolling in the grassy field. There are so many options, hanging from a tree branch, when, as and when possible. Even in the house they can engage in body movements such as reaching for a shelf, reaching under the bed, picking up objects frequently from the floor. um, and again, this applies to all the children, just not children with special needs. No, it applies to all the children. Body movements are very much needed. There's another comment: all children should have 2 to 3 hours of outside time a day during school day and while at home. Absolutely, I agree. There are a lot of research studies that have shown this, that throughout the world, this outdoor time has been cut down in school and as well as at home, and therefore children are having issues with attention, with possibly fidgety movements, impulsiveness, etc. Yes. um, I think I can't. Oh, somebody says, I love the location boundary. We have that rule in our house. Thank you. Thank you. I'm glad to hear this. I'm really glad to hear this. Somebody says everything autism strategies for home when screen time is used properly. I think that is the first comment that has come in. I'm sorry if I miss these things because I'm not very much used to the mobile phone. Parents just have to structure the time, set boundaries, and maintain consistency. So again, I don't agree with you very much on this, because again, this is, when screen time is used properly, it can help with communication, vocabulary building. Now, vocabulary building can also come from reading books together. When you are using the screen, you're reading a book on the screen versus reading a real book. On a screen, information is absorbed very quickly, whereas for in real life, when you read a book, you read slowly, you absorb information slowly, and that leads to brain development, because when the brain is learning something new information, it has to be slow, whereas a screen, it's very quickly and fast. So again, there are research studies that show that there is a big difference, there's a huge difference when children read books on the screen versus children learn to read, real books in life. And again, I'm talking about very young children. Children above 10, 11, 12, that's a different situation. But vocabulary building, communication, if the child does not have autism, does not have, if they do have adequate speech, then it can be done in real life. So I only partially agree with you. I don't agree with you fully. Yes, outdoor play is so important. Yes, I think we are, about time that we discontinued this live over here. Somebody is typing a comment. I hope I can see it. Yes, somebody says parents use being busy as an excuse for not going outside, but it is necessary for development. Bingo. Absolutely, absolutely. Yes, and the person who said, yes, of course, books are as important as well. Okay, so thank you for your patient listening, and thank you for listening to this live video. I'm sorry that we were a little delayed, because not delayed, a little maybe by 15 minutes, because it's my fault. I'm not that tech savvy as the younger generation, and believe me, I'm using the mobile phone to log into Facebook the first time in my life. So I'm not kidding. I use it. I use Facebook and all other medias only on the laptop, which are a little better with my eyes, my vision and my eye strain. So that's why we got delayed. Thank you very much.